Now we have to talk about anti-anginal drugs. So coronary circulation is the circulation of blood in the blood vessels that supply the heart muscle myocardium. The left coronary artery include circumflex artery supply blood to the left atrium side and back to the left ventricle. Other point is that left anterior descending artery, that is LAD, supply the front and bottom of the left ventricle and the front of the septum. The right coronary artery supplied right atrium, left ventricle, bottom portion of the both ventricles and the back to the septum. As you see in heart that there is a aorta and the right coronary arterial, left coronary coming at the of the PA, circumflex coronary artery, left anterior descending coronary artery. Next one is angina. Angina is a type of chest pain caused by the reduced blood flow to the heart. Angina symptom coronary artery disease is called by angina pectoris, is often described by squeezing, pressure, heaviness or tightness and pain in chest. Symptoms. The symptoms of angina are: angina symptoms include chest pain, discomfort, possibly described as pressure, squeezing, burning or fullness. Patient may also have pain in his arm, jaw, shoulder or back. Other symptoms that patient may have with angina include dizziness, fatigue, nausea, shortness of breath, sweating. There are three types of angina. Stable angina is usually triggered by physical activity. When patient climbs stairs, exercise or walk, patient heart demand more blood, but narrow arteries slow down blood flow. Unstable angina, it fatty plaques in a blood vessel rupture or blood clot form. It can quickly block or reduce flow through narrow artery. This can suddenly and severely decrease blood flow to patient heart muscle. Unstable angina can also be caused by blood clots that block or partially block patient heart blood vessel. Metal angina. This type of angina is caused by sudden spasm in the coronary artery, which temporarily narrows the artery. This narrow reduces blood flow to the patient heart, cause severe chest pain. Metal angina most often occurs at rest, typically overnight. The following risk factors increase risk of coronary artery disease and angina: tobacco use, diabetes, high blood pressure, high blood cholesterol or triglyceride level, family history of heart disease, old age. Men older than 45, women older than 55 have greater risk than do younger adults. Lack of exercise, obesity and stress. Atherosclerosis, rest to build up fat, cholesterol and other substances in artery wall, which can restrict blood flow. Classes of drugs used in the treatment of angina and myocardial infarction: vasodilator, dilate arteries and veins; calcium channel blockers, nitrodilators; cardio inhibitory drugs that reduce heart rate and contractility, उसके beta blocker, calcium channel blocker, ronaldozine blocker of lead, sodium current. Antithrombotic drugs prevent thrombus formation, anticoagulants, antiplatelet drugs. Other is vasodilator, dilate arteries and veins. Primary cardiovascular action of nitrodilator: symptomatic vasodilation, that is venous dilation, is higher than arterial dilation. Decrease venous pressure, decrease arterial pressure, small effect cardiac, reduce periload and afterload, decrease wall stress, decrease oxygen demand, coronary, prevent reverse vasospasms. Vasodilation, that is primary esophageal vessel, improves spondylocardial perfusion, increase oxygen delivery. Isosorbide monotrierate, nitroglycerin, pentathiothironate, sodium nitrophyllide. Other one is beta blocker, that block the heart is beta blocker, that BR1. First one is BR1, etanolol, bisoprolol and metoprolol. The most common side effect of beta blockers are fatigue and dizziness. Beta blockers slow down your heart rate, block heart circulation, your heartbeat more slowly when you take beta blockers. Gastrointestinal symptoms, these include upset stomach, nausea, diarrhea or constipation, sexual dysfunction, weight gain. Other one is calcium channel blocker. In this we can see that verapamil, that is calanan and viralan, and dilisatism, that is cardizem and tizac, phalodipine amlodipine and nifedipine. Amlodipine is Norvasc and nifedipine is Adatate CC procardia. Side effect of calcium channel blocker may constipation, dizziness, fast heartbeat, fatigue, flushing, headache, nausea, and rush. Ranolazine represent new class of anti-anginal drugs. This mechanism of action, ranolazine anti-anginal effect, has been determined. Ranolazine at therapeutic level can inhibit the cardiac rate of sodium current. However, the relation of this inhibition of anginal symptom is uncertain. That inhalate is normally small but processed current. It is active drug the preventive phase of the cardiac AP. Therefore, the current can play a significant role in determining the duration and shape of AIP, as you can show in graph. Other one is antithrombic drugs. In this we can see that thrombocyte platelet cell or blood cell formation. Coronary thrombosis is defined as formation of blood clot inside a blood vessel of heart. This blood clot may often restrict blood flow within of the heart, leading to heart tissue damage or myocardial infarction, also known as heart attack. Other one is antithrombic drugs, in which we can see two types: anticoagulants or antiplatelet drugs. In anticoagulant, we can see that heparin, nadoprene, calcium, varopasaban, warfarin. And antiplatelet drugs, we can see Plavix, dipyridamole, aspirin, and thrombo and AWS. In plasma, we can show you can use the warfarin K double 2 and double X in indirect heparin. It is a simple graph. Or drugs we can use that vasodilator. Internal dose, there are nitroglycerin, isosomide, monotriate, pentrathylodramine, sodium nitrophase. Internal dose is 10 mg, 20 mg, 1.25 mg spray. Or other one is 0.3 to 0.4 or 0.6 mg 400 mcg spray. And third one is 8 to 100 mg, half-life 5.1 or 5.1 to 7.5 minutes for 20 minutes. Thank you for this.